Good afternoon once again. Today is Thursday, the 18th of February 2021, and this is the English language summary of the daily press briefing here at the CCSA as always. So first of all, thank you very much to Dr. Bird, Dr. Apisamai, who gave us the Thai language edition of the briefing. She recapped on the meeting that we had this morning, as well as the relaxation of measures, the plan for the recategorization of provinces, issues in Pathum Thani, villa quarantine, as well as vaccine issues. And I'll recap just in brief these issues in due course. But firstly, starting off with the general situation, the numbers that we have for today. Today we have new confirmed cases at 150 cases, as you can see on screen. And out of that number, 104 cases were found from active case finding, which continues. And 8 are from those returning from abroad and who have entered straight into our state quarantine system. New recoveries recorded today is 249, which is higher than the number of new cases. So doing the math, the numbers are getting better. The numbers since last year, as you can see on screen, over 25,000. The recoveries, almost 24,000. So the numbers are actually meeting each other very soon. No new fatalities to report today. Cumulative is 82, remains at 82. Just some observations from the information provided by the assistant spokesperson, Dr. Pisamai. Just in Pathum Thani in particular, which we had detailed a bit yesterday already, just that the average infection rate in Pathum Thani is around 4% from the active case finding in the markets, the 4 fresh markets. If you recall, yesterday I had outlined that, around 4% infection rate, which is quite lower actually than the 7% infection rate from the active case finding in another province, which is Samut Sakhon. So on the issue of relaxation of measures, today's CCSA Special Committee on the relaxation of measures discussed the level of COVID risk in each province and the plan to readjust the zoning of control areas as proposed by the Ministry of Health, Public Health. So as the situation of the outbreak is getting better, we monitor it on a daily basis. As you would know, we have the EOC, Emergency Operations Center, meeting every morning. And as the situation is getting better for most part of the country, the Health Ministry has proposed for the easing of restrictions starting this coming Monday, if the proposal is approved by the CCSA General Meeting on Monday, chaired by the Prime Minister. Now, the provinces that had been previously categorized as high controlled or red, namely Bangkok, Nonthaburi, Pathum Thani, and Samut Prakan, will most likely move down one tier to the controlled area or orange, so from red to orange. The province of Tak, Ratchaburi, Samut Songkhram, and Nakhon Pathom will remain in the controlled area level orange. So therefore, Samut Sakhon will most likely remain in the highest level of maximum and strict controlled area or in dark red. And 14 other provinces will be categorized as high surveillance area or yellow, and 54 provinces will be in surveillance area or green, as you can see summarized on the screen, this very good, nice infographic that we produced on the screen for you. So as you can see, in general, the provinces are actually shifting down the scale from dark red to orange or to yellow. So the most number of provinces now are, of course, in green, as you can see, and then comes the 14 provinces in yellow, and 8 remain in orange, and only 1 remain in the red zone area. So this will be finalized on Monday, as mentioned. This relaxation of measures will also allow the businesses to reopen or operate in longer hours, enable more social and economic activity to continue. In the controlled areas in particular, the reopening of pubs, bars, karaoke venues would be allowed until 11 p.m. Restaurants may open until 11 p.m., while alcohol may be served until 11 p.m. as well. If you recall, for alcohol in certain zones in the past weeks, it had been allowed only for take home and not for consumption in the restaurant. But with these readjustment, which will be finalized on Monday and will be announced officially on Monday, there will be some of these relaxation measures, some changes in accordance with the current conditions, and to support the economic and social activities of the country. The governors of each province, however, remain with their authority to issue orders to close certain venues or to impose stricter disease control measures than the ones announced by the central government. Therefore, it's advised to be informed about your own provincial measure as well. That still stands. The CCSA remains to urge the general public to remain vigilant, to be conscious of your own health safety, and continue practicing DMHTT in order to allow the restrictions to be further relaxed and preventing the virus to return and affect our normal way of life. So yesterday, before Dr. Tuisin left for the provincial inspection, he mentioned about the villa quarantine issue. So today I'll recap that a bit. The committee had the committee meeting this morning and yesterday had discussed about the new option, the new type of quarantine facility, or the so-called villa quarantine. So as you know, in Thailand we have various types of quarantine: ASQ, SQ, hospital quarantine, organizational quarantine, and the like, factory quarantine. So now the term villa quarantine had been previously approved by the cabinet already, and in this villa quarantine arrangement, a group of foreign visitors will be quarantined together in a designated facility. And during the first 5 days of the 2-week quarantine period, each person will be required to be confined to their own room separately for 5 days. In the rest of the quarantine period, they will be allowed to use the facilities in the designated area if their COVID testing results are returned negative. So this is sort of like a new scheme, a new adjustment for those who come together as one group, mainly for tourism purposes. So as a test run, the first group of visitors of this type, with approximately 70 persons under this arrangement, will arrive this Sunday on a chartered flight and will be directly transported to Si Panwa Hotel in Bangkok, in Phuket. They will be required to be tested for the virus and undergo this arrangement strictly. The requirement to be tested is similar to all visitors. The sort of adjustment is in the manner in which they will be quarantined only. But of course, they will still be quarantined with the first 5 days in separate rooms and the rest of the days in allowed to use facilities within their own designated area. So for this case, within the hotel itself, and of course in a controlled area. So the health authorities and tourism authorities will closely monitor and evaluate this new quarantine program, this new arrangement. And if you find it as effective and successful, it will help and largely benefit the country's tourism industry, which we aim to reboost and we aim to take care of. And we might consider this as, after the pilot program, as a new type of quarantine for visitors to Thailand. So just in brief, this is what I have for you. Just before ending, I would like to just PR a bit on an English language radio program, and we'll have a poster up there for you for some time. Yes, this one. So just to PR that the Ministry of Foreign Affairs has an English language program called MFA Update on radio, and it's on FM 88 megahertz, FM 88 megahertz, or Radio Thailand. And for tomorrow, Friday the 19th at 8 a.m., around 8 a.m., 8:05, we'll have a speaker on the topic of repatriation, COEs, and assisting nationals during COVID-19. So it'll be an English language interview with Mr. Naruchai Ninnat, who is the director of the Protection of Thai Nationals Abroad Division, Department of Consular Affairs. The division actually also handles COEs for foreign nationals and issues regarding COVID and foreign nationals coming to Thailand. It'll also discuss the ministry's duties and commitments in assisting Thais and foreign nationals during COVID. It will also elaborate on regulations and the process, which could be quite useful for those who have plans to travel inbound and outbound of the country at the moment. So this program, we'll be having it tomorrow, FM 88 megahertz, Radio Thailand at 8 a.m. And we'll be having it actually every week, every Friday morning at 8 a.m. on this radio channel to provide you with another outlet of English language information via radio regarding COVID and regarding other issues of interest. So Dr. Apisamai mentioned some issues about vaccine towards the end of the presentation as well, that on the 24th of February, we'll be having the first arrival of the vaccines. Mind you that it is for emergency use, for the emergency use and those who are in the front lines first, in the front lines of for the medical personnel and the like. And in due course, in the following months, the government has confirmed that the second batches will be arriving in Thailand for the rest of the population according to the plan that we'll be having. One question that we received on social media for the English language audience is that there was a question whether if you had been vaccinated in inoculation abroad already before traveling to Thailand, would quarantine still be required? So the question is a good question. The answer is that yes, you will still be required to undergo quarantine. That is compulsory for arrival in Thailand. As you would notice, there is not yet an international arrangement or agreement or standard regarding vaccines yet. In the future, there might be some sort of documentation in that regard, but at the moment, not yet. And many countries have not yet been receiving their vaccines. Some countries have started vaccinating their people for emergency use, the vulnerable groups, but the majority have not yet. So that remains to be seen. We'll be adjusting in due course. We look forward to the arrival of our own vaccines on the 24th of February. So I guess that's all I have for you for today. Thank you very much for your attention, and then we'll see you again tomorrow. Thank you. สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐ